Hi everyone, and welcome to Let's Just Do This. Today we have a very special edition of Let's Just Do This. And Todd Miller, we're trying out some new technology here in studio.
We are.
We're going to actually bring in Skype, and a very important person is going to be joining us a little bit later in the show. We're so honored to have guests that come to this show, experts from across North America, to really bring not just their expertise, but their passion for integrative health, which, as you know, here on Let's Just Do This, that is our mandate. So without further ado, I'm really excited to welcome in studio Dr. Carolyn Teske from Eyes Focused on You. Now, Dr. Teske has been on our show before, an amazing holistic optometrist, happens to be my optometrist. Not only is she an amazing clinician, but she puts the patient first, has some of the best diagnostic tools in her office. But more importantly, one of the things I respect the most about you, Dr. Teske, is your willingness to collaborate and link arms with all types of healthcare professionals to improve the outcomes for your patients. So welcome in studio.
Oh, thank you so much. It's a pleasure to be back.
So today I thought it would be really important to talk about a disease that so many Canadians are suffering with. And in fact, eye doctors are often the first line of defense in finding this disease, and that is diabetes. Now, as an optometrist, you're looking in someone's eyes, which is the window often to their health. Can you speak to the incidence that you're seeing in terms of diabetes and why it is so critical to see an optometrist on a regular basis? And then we're going to talk about the ophthalmologist that we're about to introduce everyone to.
Absolutely. You know, it is our passion to educate patients ways in which they can empower themselves to live better and live longer, right? And certainly diabetes is one of those lifestyle diseases that we know where we can make a difference. The eyes for sure are the window to the rest of your body, and often we're involved at seeing things in the eye that actually are reflective of what's happening in the rest of the body. So diabetes is one of those things. You know, small little blood vessels that hemorrhage that really don't cause any vision problems can be a reflection of what's happening in the vascular system. So you really want to see an eye doctor routinely, not necessarily to find anything, but if we do find something, that we find it early enough, and then we don't need to resort to, you know, tertiary care and actually have surgeons involved. So be proactive with your health, not reactive.
It's such an important message. And, you know, one of the things that impresses me most is the network that you have. And it's with my absolute honor to be able to introduce to all of you at home today, Dr. David Wong, who is the Chief Ophthamologist at St. Michael's Hospital. He's a retinal specialist, and he's joining us via Skype from St. Michael's Hospital after an incredibly busy afternoon in clinic. Dr. Wong, welcome to the show.
Thank you very much. Welcome to thank you for being here, for me being here.
You know, it's such an honor to have you here with us and to be at the table to talk about how professionals and healthcare professionals can work together. One of the things that amazes me as an eye surgeon, why do you believe that wellness is so important when it comes to your patients? Why should we care about this thing called integrative health?
Well, it's a very important aspect. You know, the eye is part of the whole body, and it was Dr. Teske just said, it's you can see a lot in the eyes, and that can reflect a lot of the diseases that happen in the body. And we are sometimes the first people that can recognize these diseases, such as diabetes, hypertension, and in fact, other diseases like are some forms of uveitis, which is a form of inflammatory conditions in the body. It's these things that we see, we can get other healthcare practitioners involved very quickly. So it's the best interest of the patient to be treated early and get their disease and problems under control.
Right.
What is the impact of nutrition and diet on eyes and overall health? I think we know some things, but I'd like you to talk just for a few minutes about that.
Well, it's a very important area because diabetes itself is nutritional in that sense. So many of the diabetics we always see, we tell them we got to control their blood sugars. In fact, one of the measurements for blood sugar is called the hemoglobin A1C, which is the 3-month kind of sugar measurement, is actually derived from the development of eye disease, retinopathy. And so educating the patients to control their dietary intake, to make sure they're talking to their nutritionist, dietitian, to get that involved. Another disease such as macular degeneration. We know in macular degeneration, as one ages, that blood vessels and damage in the retina can occur, and we know that certain vitamin supplements decrease that disease. And in fact, the literature is now showing, the research is now showing that stuff that's good for the heart is actually good for the eye in terms of the vascular diseases.
Right. So now you as a surgeon, and we all know the way our medical system is set up, we're often working in silos. And what impresses me so much about someone like yourself is that you're willing to have a conversation with healthcare professionals like us, although you have a specialty. Are you seeing a change? And this is something I'm really curious about. Are you seeing a change with all of your colleagues and even with patients wanting to take a more proactive and integrative approach to the management of disease and in terms of their outcomes?
Well, I think that it's definitely that's happening, and including myself. We're even though I'm a surgeon, I'm an ophthalmologist, I'm still a patient too, and I want to get involved. And like everybody here, we all want to be involved in our care. And I think days are gone where physicians or the healthcare practitioners that on the pedestal and on the silo type. We have to be integrated. Part of the issue is also we are so subspecialized in our field. We have to work with other people. There are things that in medical school I don't remember anymore, and that is all changed. So we have to integrate. In optometry, like yes, I did maybe a few days of learning how to refract and give proper glasses. I'm not very good at it, so I got to rely on my optometry colleagues to make sure the proper prescription of glasses are seen, and they are seeing the patients more than I have to see these issues. And when they see them, yes, refer them in or deal with what they can deal with in the scope of practice to help us all for the best of our patient care.
This is music to my ears, and I know to every patient that's out there listening. Dr. Teske, before you came in to the studio today, of course, you were in clinic as well, and you actually were dealing with a bit of an emergency, a retinal detachment. Can you just speak to what a patient can expect and how someone like you, collaborating with someone like Dr. Wong, who's a retinal specialist, how that makes such an impact on the outcomes for patients?
This patient who called really was questioning whether or not he actually needed to be seen today or not. And of course, as my team approaches us very cautiously, not wanting to add to our already a busy schedule, they're taught and trained to be the advocate for the patient. So it's always better to err on the cautious side and see the patient and make sure that there's no issues. Because of exactly this same kind of patient. So he did have a concern. He had flashes a few days ago and then floaters, and was concerned that this change in his vision was a problem, and indeed it was. The wonderful outcome is that patient was pathed very efficiently and very quickly when we do work well together, rather than have to sit at an emergency room in an ER to see an attending physician who then has to call a surgeon, the next day. So when we work in that better together model, that patient is efficiently given the care that they need, and the prognosis then for treatment and recovery is so much better. So everybody's work is easier.
It's so true. It's so true. Dr. Wong, let's go back to looking at and educating the masses on what is the leading cause of blindness right now in working age? What is the leading cause of blindness?
Well, one of the things, there are various forms of quote, blindness or visual loss, but one of probably the biggest area and one that's most concerning to us now is diabetes. It is, as we probably all talk about, and you might have heard the term, it's the tsunami that's coming. And the visual loss from diabetes can be very significant, and it can affect many people, and specifically the breadwinner of the house, and that affects the whole family, and it affects the vision where they can't do their job. And so that is probably one of the biggest areas of our concern that's going to overcome our capabilities of our system. And the nice thing about it, though, is we have treatments for it if we get the patients in early. I can tell you today I had 2 patients who were bad diabetics. They were not referred in early, and because they weren't seeing their optometrist. One guy actually said, I haven't seen my eye doctor in 5 years, and I told him that's a mistake, because if he was caught early, he would have been sent in and taken care of. So this is probably a very important area of concern for us.
Prevention is key. Now, Dr. Teske, you can speak to the role of diagnostics, and certainly there's some technology in your office, and as a patient, I'm thrilled that you have that, something called the Opthamap. Can you tell everyone, the role that that type of technology can play in prevention and finding things perhaps when a patient is still asymptomatic and not waiting until they're seeing Dr. Wong in crisis.
Absolutely. You know, I mean, certainly technology, imaging, digital images versus laser images, they only enhance the work that we do. And it's an adjunct therapy, right? So my eyes certainly are able to see, but when you use technology to add to what, you know, the clinician can do, then you're just seeing that much better. So we've had that particular tool probably for close to 2 years, and I know that I've sent probably over 600 patients either back to their primary care physician or to a retinal specialist because I'm seeing things that I may not have seen. You know, because it requires patient cooperation, pupil size, the right lighting, the right positioning, which of course is still, you know, a priority, and that is definitely something, those tools we still use. But when you add technology to it, then you're just that much better and that much more efficient.
Absolutely, and I know from a patient perspective, and I've witnessed this in your clinic, that seeing is believing. And although a patient can be asymptomatic and they don't know that they are pre-diabetic because they don't have symptoms or they can't feel symptoms, but yet you can show them a peripheral bleed. It's almost like an eye-opener and a wake-up call.
Literally.
Literally it is. So just very quickly before we go to break, Dr. Wong, can you explain to all of us why diabetes impacts vision?
So diabetes impacts vision quite significantly. There's two big areas. One is, as in diabetes, basically the blood vessels get weak or there's ischemia involved. That ischemia meaning tissues are dying. Cells are starving for sugar. That's one of the biggest problems of diabetes. And so one of the best definitions of diabetes I've ever come across is starvation in the midst of plenty. You have plenty of sugar, but the cells can't use the sugar. And so they start to die, and they die, and the vessels leak, and they can get this swelling in the center of the eye called the macular edema, and then get blurry vision, and that's one of the reasons they present. Other ways they present is if they see a lot of floaters. That is a lot of spots in their eyes, and then when we look in, we can see bleeding. And these what happens is because the eye is starving for food, it grows new blood vessels. And when these new blood vessels grow, they can bleed and leak, and that causes a significant visual loss. So those two things together or independently create visual change that patients will come and seek attention. And if we catch them early through every vehicle, then we can get an early treatment for them.
That's fantastic, and that is the good news. You know, we need to take a break here for a quick minute, but we will be back with both Dr. Wong and Dr. Teske to talk about your eye health and integrative approach. Stay tuned, we'll be right back.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy, and in studio, Dr. Carolyn Teske, and Dr. David Wong is joining us on Skype. I have heard this term, and it's called diabetic retinopathy, which is something I'd like you to explain. As a layperson, I don't have a good appreciation of it.
Yeah, so retinopathy means a disease of the retina, and the diabetes is causing the disease, and this is where you can get the blood vessels leaking, causing macular edema, or bleeding inside the retina itself, the retinal tissue, and you get these little blood spots and dots. And then neovascularization, which is the abnormal blood vessel growth, which is the deadly part of diabetic retinopathy.
Now, you did mention earlier the importance, and you continue to reiterate the importance of prevention. And I know, Dr. Teske, you feel the exact same way when you're seeing a patient in your clinic. Can you speak to the importance of nutrition, vitamins, and supplements, to the role that they actually play in our health? I certainly know, as an owner of an integrative clinic and a therapist, the role it plays in our tissues. I feel it every day in the changes. When Dr. Wong was talking about ischemia, I mean, ischemic pain in muscle is very evident. I get that. What role does food and nutrition play in eye health?
Absolutely. You know, I mean, you said it and referred to it just now. You feel it, you sense it in the tissues. Well, the eyes are the same tissue, right? There's really only 3 germ layers that make up our entire body: ectoderm, endoderm, mesoderm, and all of those tissues are reflected everywhere. So it just makes sense to me that when you're fueling your body with the right foods, the right vitamins, minerals, and supplements, that all of those tissues will stay healthier. So why would an eye doctor talk to you about nutrition? Well, why not? Because when we work better together, we see outcomes.
Well, and one of the things I love about the way you practice, and this is why we practice together and why I'm so honored to have someone like Dr. Wong or Dr. Shirley Ha that was on another show with us, and that is recognizing that we all have our strengths and have tools in our toolboxes, but together all of those tools are only going to improve the outcome of the patient. What I love also is being able to make a good referral, as you do to Dr. Wong when you've got a retinal detachment, or when we're talking about referring to a dietitian. I really want to see more practitioners thinking about linking arms and referring, not just to be out of your scope, and we're by no means suggesting that an optometrist is a dietitian, so I don't want any flashback from dietitians out there, but to be able to refer and recognize the importance of it and the role that it plays in both prevention and also in healing. As a surgeon, Dr. Wong, would you speak a little bit to the role that nutrition and maybe even protection, from the sun, for example, has on eye health and outcomes for your patients?
Well, nutrition's paramount. The body goes in, when it's malnutritioned or malnourished, it goes into defensive mechanisms and starvation modes, and things happen. And so eye, like any other tissue in the body, is important to have the proper nutrition and oxygenation and all those things. So that's, and hydration. So those are very important. And again, things like diabetes is very important. Macular degeneration, we have clinical evidence, that is evidence-based medicine, showing that these certain nutrients, that is certain vitamins, reduce the disease process. It's the only studies that have shown that vitamins and lutein and zeaxanthin and things like that actually reduce the proliferation of this disease. And that's a very powerful statement in terms of these nutrients. So yes, it's important. As for the sun, it's really important because the sun damages, and we know that it damages skin. We get skin cancer, it damages eyes, that's how you get cataracts. In fact, when you get cataracts, it reduces the light to the back of the retina, which is protective. But if you don't, and you get ultraviolet light to the back of the blue wavelength, it damages the retina. So again, things like that, wearing sunglasses, all these things protect and help, and important everybody learns that.
So important, yeah. Now, Dr. Teske, in your clinic, taking a look at the wide range of people that you see, can you just give us a sense of, and when we're thinking about collaborating, what types of, I'm not articulating myself the way I want to here. When we're looking at the wide range, so from children to seniors, and the changes in lifespan, does eye care change with the changes in lifespan?
Yeah, absolutely.
Right.
I think both Dr. Wong and I, our jobs are secure because certainly at every stage and age of life, there's change. And I think when you embrace that change, and just recognize what is normal and what is not normal, and you're in on the story before the problem is too advanced, then hopefully my referrals to Dr. Wong are less. And what we're doing at every age and stage is just reassuring the patients that they are healthy.
Right. Dr. Wong, is there any new technology or research that you're involved in at St. Michael's Hospital that you'd like to share with us with regards to eye health, whether it be related to diabetes or any other condition? I always love to hear from the experts, and you being the chief of ophthalmology at St. Mike's, I'd really love to hear your take on that.
Well, there's a lot of new stuff coming down the pipelines, and that's one thing that's fun about our field. There's a lot of, and I hate to say that I'm a surgeon, and we do a lot. Think like an engineer, so we have a lot of toys, I call it, and a lot of drugs. So we have, like, one of the things we have is some new drugs coming down to treat diabetes and diabetic retinopathy, and we have these ones we inject in the eyes. They're fantastic, and we have some newer ones coming down the pipelines. We have new imaging things. So one of the things in my area that I'm doing a lot of research is a totally new technology. Hopefully we'll be able to diagnose diabetes even earlier by just doing a special scan looking at certain layers of the retina. So very high-speed technology. And of course, the surgical side is we have some new stuff. We have a new unit where we can actually do three-dimensional surgery, put in like a heads-up display, we call it. And we can get in really deep into tissue and look at three-dimensional views. So that's been very fun and interesting, and some all these new tools and toys that are coming out. So I think it's very promising in the future. But I think, again, I totally agree with everything that's been said. Early detection through everybody, through optometry, nutritional people, family doctors, everybody, integrated health to get everybody into the system early. It's so key.
It certainly is. I mean, we were talking about exercise before and the role that exercise is playing, well, certainly in the prevention of diabetes, type 2 diabetes, but also in just our mental health. And we were talking on our last show about eyes and mental health and the role that it can play. Dr. Teske, from your perspective as an optometrist, what do you want to see more? If you could do a call to action for all new parents and families out there, what do you want to see happen? And healthcare professionals, as an optometrist, you're one of the leaders, and I have to tip my hat to you as an optometrist to really be leading the charge, to be doing media, to be looking at bringing people like Dr. Wong and Dr. Ha together with people like myself, which most ophthalmologists wouldn't be having a conversation with a massage therapist who does microcurrent point stimulation therapy, which, by the way, Dr. Wong, we have some exciting research coming down the pipe that we want to share with you about microcurrent and eyes. Why does it matter to you to lead that kind of practice, and what do you want patients to know?
You know, it is truly a pleasure to be surrounded by all of this brilliance. You know, what ophthalmologist takes time out of his day to share my passion and help educate patients on the importance of preventative care. So thank you, Dr. Wong, for doing that. And thank you, Margaret, for being the lead in this. But So what would I like to see? I would like to see the patient be the CEO of their body in the middle, and all of us, Dr. Wong, Todd, you can come too, because you can be an ambassador for health, and Margaret as a massage therapist, and me as an eye doctor, and all of our healthcare providers surrounding the patient, and the patient being their advocate and their CEO, to be able to live longer and better.
Yes, and I think with people like Dr. Wong, who clearly, I mean, this gentleman is at St. Mike's doing a clinic this afternoon. It's crazy busy. He took the time out earlier to do a test drive of Skype so we could make sure we could do this show today. But where he actually believes in education, our future is bright when it comes to healthcare, but we've got a lot of work to do. We need to work together with government. We need to work together with insurance companies. We need to empower patients through education, which is why I feel so blessed to be able to bring shows like this and other documentaries. Dr. Wong, we want to do a documentary on diabetes, an integrative look at diabetes. I'm going to ask it on air because I'm bold. We would love to have you be one of our leads in our integrative documentary on diabetes, and maybe perhaps even come to St. Mike's Hospital where the action happens, to really take a look at how we break down these silos and educate integratively so patients can play a bigger role in their health. What do you think?
I think that'd be a great idea.
I love it.
It's intriguing because it's exactly one of the things we're running now on we called it integrated approach, integrated healthcare, coordinated eye healthcare, we've called it. We've actually written a paper about it, how important that is to get everybody involved.
Yes. So the answer is yes, and you'll be a lead. I've got you on the spot, but you can tell
got me on the spot.
I'm passionate about it. Well, it is so important, and I know one of the reasons why you're there, Dr. Wong, and we need to give a shout out to Dr. Dean Smith and the team at TLC. We did, Dr. Teske and I, along with an incredible team of integrative healthcare professionals, produced a show, a documentary series on cataracts and one on seniors and eye health. And we know the need is there for education on diabetes. I'm very involved, the Healthy Communities Initiative in the community where my clinic is in Brampton. We have staggering stats with the rise of diabetes, and this is preventable. The fallout costs on our healthcare system is shocking, actually, and especially when this can be prevented. But we aren't going to see change unless we actually change. And those types of things, like documentaries and bringing us together, need to happen. So I'm saying it here and making a commitment right here, right now, with Todd by my side and Dr. Teske and Dr. Wong. We are going to bring an amazing team together, and we want to hear from all of you out there. If you're suffering with diabetes, you're going to want to listen up to this documentary, because we are going to bring all parties to the table, nutrition and mental health and you know, everything that we can do to really empower people to live better. Dr. Wong, I know you got to get back to clinic. I just want, on behalf of our entire team here and all of our viewers at Let's Just Do This, I want to thank you for your time and your energy, and really for your vision to really help change healthcare and bring all of us together. Thank you so much for joining us.
Thank you. Thank you for having me.
And we'll have you back again. sometime soon. And
Okay.
Thank you. And Dr. Teske, I just, you're always coming with new information and a willingness to bring others to the table, and we're grateful for that. I just want to personally thank you, as many of your patients do each and every day. It's because of people like you that integrative health is moving forward, and you are doing it with grace and courage. And I'm just really honored to be able to do it alongside you.
Thank you. It is truly empowering and a pleasure.
Well, Todd, like always, have you learned something today?
Yes, I am the CEO of my body. I'm going out to Staples and getting business cards right after this.
You know what? And for many of us, that is the attitude we need to have. We do have the ability to take control of our health. We can be an active participant in it, but we have to do that through learning and through changing. And that's what this show and everything we do here at Let's Just Do This is about. So on behalf of myself and Todd Miller and everybody here at YourTV, thank you for tuning in, and be sure to stay in touch. We want to hear from you. What is your family struggling with? Make sure you follow us on every channel, Facebook, Twitter, you name it, iTunes,
Google
Instagram,
Play,
we're everywhere. But whatever you do, please stay connected. And until next time, be well.